Alhamdulillah, salatu wassalamu ala rasulillah, amma ba'd. So this is a website called CPAR. It's the John Hopkins Office for Critical Event Preparedness and Response. They are saying that the John Hopkins University is among the entities continuing to put preparedness as a priority. Two separate areas of the university recently held two different tabletop exercises in October 2019, each with different goals. So on the 18th of October, the John Hopkins Center for Health Security, in collaboration with the World Economic Forum and the Bill and Melinda Gates Foundation, hosted Event 201, an exercise simulating a global pandemic in New York City. The goal was to outline preparedness efforts, response, and cooperation from business, government, and public health leaders to reduce economic and societal impacts of a pandemic. This was a very different kind of exercise compared to a hospital disaster drill, says Eric Toner, MD, the exercise's project director and a senior scholar with the Center for Health Security. The goal was not to test functional capabilities, but rather to raise awareness of very complicated and difficult policy issues. Toner, who is CPAR's senior advisor and subject matter expert for health security, says, "So, in other words, it is more of an educational tool than a test." Event 201 simulated a global outbreak of coronavirus transmitted from bats to pigs. A global outbreak. It simulated a global outbreak of coronavirus transmitted from bats to pigs to people. Bats to pigs to people, which led to a pandemic of coronavirus-associated pulmonary syndrome, CAPS. CAPS is a viral illness that can cause a range of health concerns from mild flu-like symptoms to pneumonia and even hospitalization or death. In the exercise, a mock emergency board was convened to respond to the CAPS pandemic and provide recommendations to deal with issues that develop as a result of the outbreak. The mock board was composed of representatives from various organizations, including the US and China Centers for Disease Control and Prevention, United Nations Foundation, as well as professionals from the airline, hotel, and media industries. Some issues discussed during the exercise were the distribution of medication and medical supplies, the impacts of travel and trade bans, prioritizing financial resources, and management of misinformation. We think the risk of management of misinformation. Wow. We think the risk of a severe pandemic is small but real, and the cascading consequences are largely unappreciated, Toner says. He adds that the outcome of Event 201 showed that there is a crucial need for public-private collaboration in preparedness and response. This is the fourth major policy exercise the Center of Health Security has done since 2001. Incredible. So before the coronavirus struck, a simulation of a global outbreak of coronavirus transmitted from bats to pigs to people. A simulation with the same range of health concerns, mild flu-like symptoms to pneumonia. And what was it they were testing? They weren't testing how they could respond medically to the potential virus, but they were talking about preparedness to control the economy, to prevent it from collapsing in a cascading way, where you have so many interdependencies that the failure of one component has a domino effect, causing many other components to fail. Incredible. So Event 201, is that the actual, are we now in the actualization phase of this simulated event? See if there's any more information on this. They say here that a severe pandemic which becomes Event 201 would require reliable cooperation among several industries, national governments, and key international institutions. Now, also take note that two of the countries listed in that simulation were the United States and China. Wow. Let's look at the media related to this event. There's some photos here. Who's this person? Not sure why this browser's behaving funny. The exercise team included Eric Toner, the MD, as the exercise team lead from Johns Hopkins University, Crystal Watson, Tara Kirksell, also from Johns Hopkins Center, Ryan Morhard, JD, as a lawyer, from the World Economic Forum, Jeffrey French, from the Bill and Melinda Gates Foundation. Other team members included Tom Inglesby, Anita Cicero, Randy Larson, US Air Force retired, Caitlin Rivers, Diane Meyer, Matthew Shearer, Matt Shearer, Matthew Watson, Richard Bruns, Jackie Fox, Margaret Miller, Carol Miller, Julia Sizek. I don't know any of these people's names, I'm not familiar with them. It was also supported by funding from the Open Philanthropy Project. So there you go. I mean, if you ask me, this global pandemic of the coronavirus, which has the exact same name as what they talked about in the, it's not COVID-19, but it says coronavirus. To me, this is what we're going through right now. Now, is the coronavirus that they're talking about in today's real event, is it an actual virus, or is it just some sort of media propagation? I don't know. I mean, they could have used an actual virus, deployed it in certain countries. But again, they had China involved in the exercise. I don't think there's any country who is outside of this globalized world. We're living in an empire. And the leaders of this empire are doing what they want. Now check out what they said about controlling information, or what they call misinformation.
And finally, governments in the private sector should assign a greater priority to developing methods to combat mis and disinformation related to pandemic response. Governments will need to partner with traditional and social media in order to research and develop nimble approaches to countering misinformation. For their part, media companies, we believe, should commit to ensuring that authoritative messages are prioritized and really false messages are suppressed. So those were our initial thoughts, and we'd love your ideas.
So let's look how the exercise turned out in the end.
Video, and you can see the outcome.
The outcome of the CAPS pandemic in Event 201 was catastrophic. 65 million people died in the first 18 months. The outbreak was small at first and initially seemed controllable, but then it started spreading in densely crowded and impoverished neighborhoods of megacities. From that point on, the spread of the disease was explosive. Within 6 months, cases were occurring in nearly every country. At first, wealthy countries with advanced healthcare and public health systems were primarily able to limit the spread of the disease within their borders. As systems became overwhelmed, however, no countries were able to control its spread.
Okay, so that's the case at the moment.
And the disease affected people of all socioeconomic status, from the very poor to the extremely rich.
That's the same as today, where you have the Prime Minister himself supposedly getting coronavirus, Idris Elba Kevin Durant, and so many poor people whose names we don't know.
From sanitation workers to CEOs and national leaders. The economic consequences were dramatic. The high death toll and even greater numbers of sick hurt productivity in many industries. Manufacturers were having trouble filling orders, and countless companies in the service sector simply shut down.
Well, manufacturers of PPE are struggling to keep up with orders. We know that. And banks seem to be getting support from and subsidies from government to prevent them shutting down.
The global economy was in a free fall. The GDP down 11%. Stock markets around the world plummeted between 20 and 40% and headed into a downward cycle of fear and low expectation. Business.
I'll have to check the actual GDP numbers at the moment. But I don't think it's as bad as what was predicted in this video.
Businesses were not borrowing, banks were not lending. Everyone was just hoping to hunker down and weather the storm. While nearly all businesses were affected, certain sectors were especially hard hit. Travel, finance, service, manufacturing, healthcare, and insurance among them, with some major companies going bankrupt. And there were seismic societal consequences.
So that is correct. Many companies have been impacted, especially in the travel segment. But surprisingly, I haven't seen any notable bankruptcies as yet. You would expect in a sort of just-in-time economy that where everything is built based on minimal cash and ordering just in time, that there would be a lot more bankruptcies. I haven't seen that yet, but that may be because the government has, in many countries, have introduced what they call holiday periods on paybacks to banks, etc.
Consequences as well. The world saw large-scale protests and in some places riots. People were angry about the lack of access to healthcare and medicine, as well as government's inability to protect them from the disease.
Not sure if we've seen riots anywhere yet.
This led to violent crackdowns in some countries and even martial law.
I have seen articles from, let's say, reports about India and the Philippines, maybe one or two other countries, where their leaders or their ministers have announced not martial law, but shoot-on-sight orders for anybody breaking the curfews.
Political upheaval became the rule across the globe. The public lost trust in their respective administrations. Several governments fell, while others were desperately striving to hold on to power. This spurred further crackdowns.
Also, I'm not sure if I've seen any people trying to overthrow their governments yet. You could expect that would take place in somewhere like Italy or in Iran, which perhaps would be a potential objective of this virus.
Crackdowns. Attempts to control media messaging, originally aimed only at health-related misinformation, became used increasingly to quash political dissent.
And we know that the media is being used to, as they call it, control misinformation. All you hear on the TV, no matter which channel you're on, or what you read in the newspapers, with regards to the coronavirus, is identical everywhere you go. You don't see alternative positions being discussed. It's like a consensus. Everybody's agreeing with the government narrative. So here we can see controlled propaganda pushed through the mainstream media channels, whether it's satellite news or even internet. And we've seen with various channels on YouTube and Hangouts, when people are mentioning the word coronavirus in their title, description, or even talking about it, their videos don't get, you don't get notifications for those videos going live. So YouTube is suppressing information with regards to coronavirus unless it's from official sources.
Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer. We have to ask, did this need to be so bad? Are there things we could have done in the 5 to 10 years leading up to the pandemic that would have lessened the catastrophic consequences? We believe the answer is yes. So, are we as a global community now finally ready to do the hard work needed to prepare for the next pandemic?
So there you go. That's event 201. Interestingly, this is not the only event which was preceded shortly with a simulation or some sort of exercise. So don't forget the 7/7 terror attack in London, July the 7th. Peter Power and his organization staged a simulation for a corporate client where the exercise was to simulate the exact same thing. Check out what he says.
Issue. Today we were running an exercise for a company, bearing in mind I'm now in the private sector, and we sat everybody down in the city, 1,000 people involved in the whole organisation, but the crisis team, and the most peculiar thing was we based our scenario on the simultaneous attacks on the Underground and mainline station. So we had to suddenly switch an exercise from fictional to real. And one of the first things is, get that bureau number when you have a list of people.
So he said we had to switch the exercise from virtual to real, or from exercise to real. They were conducting a simulation at the same time. Let's also remember that on September the 9th, 2011, the US military conducted a training exercise. Let me read what the article here says. The US military conducted a training exercise in the 5 days before the September 11th attacks that included simulated aircraft hijackings by terrorists, according to a 9/11 Commission document recently found in the US National Archives. In one of the scenarios implemented on September the 9th, terrorists hijacked a London to New York flight, planning to blow it up with explosives over New York. The undated document entitled NORAD Exercises Hijack Summary. So NORAD was the North American air defense organization. In the September the 9th scenario, the fictitious terrorist goals seem to have been to kill New Yorkers with the rain of debris following the plane's explosion. However, in the exercise, the military intercepted the plane and forced it away from the city. That didn't happen on 9/11. NORAD failed to respond. They were actually told to stand down. So there you go. There is a history of actual events taking place, being preceded by exercises and or simulations prior to the event. So let's put it like this. If this is an exercise, when I say exercise, an actual event staged, shall we call it a false flag? If this is a false flag event, now there's a difference between a hoax and a false flag. A hoax means it's completely fictitious, and false flag means, no, it's an actual activity, but it's planned and managed by a group. So this, I won't say it's a conspiracy, but it's a planned event. Now, if this is a false flag, what do we do about it? What should we do about it? In this age of information control, first of all, can we get the word out? Second of all, if we do get the word out, what do we do about it? Do we just allow our governments to do what they want with us? How many more 7/7s, 9/11s, coronaviruses, and pandemics, etc.? How many more of these events are we to see and experience? When will it stop? Let's also not forget that the website that everybody uses to report or track the coronavirus numbers, this website I'm looking at here, where you can see a total confirmed count of 1,123,024 confirmations 58,982 deaths. And you can see a picture of the map. Sorry, it's not very good screen picture. But anyway, there you go. Whose website is this? This is Johns Hopkins University's website. The exact same university that did the simulation in October 2019, event 201. So make of this what you will. I would like some feedback. I would like you to tell me what we should do about it. Do we just sit back silently and allow these people to continue doing what they're doing? Or do we come up with a plan? Do we organize? Do we coordinate? These people in charge, wouldn't you say they are a virus themselves? I'd like your opinions. Thank you for watching.